Mr. Alok Mukherjee, Director, Woodlands Multi-Speciality Hospitals Limited, Kolkata. I request Mr. Mukherjee to come on stage, please. I request Ms. Richa S. Devgupta, Zonal Director, Fortis Healthcare Limited, Kolkata, on stage, please. A big round of applause for all of them, please. Dr. Srijan Mukherjee, Director, Calcutta Institute of Maxillofacial Surgery and Chairman, Indian Board of Oral and Maxillofacial Surgery. We welcome you all, ma'am. Sir. Subhash C. Mandal, Vice President and Chairman, Indian Pharmaceutical Association. A big round of applause for them. And Mr. Bhudev Chakraborty, Honorary President, Center for Development of Excellence. A big round of applause for all of them. I'll request Mr. Alok Mukherjee to chair the session.
Okay, very good afternoon, ladies and gentlemen. As Rupak in the last session repeatedly mentioned that we are getting very delayed. And so you can understand we are still more delayed because it is the next session. This topic of this particular session is something slightly different. And that is connection, how Make in India and healthcare. Why Make in India comes in healthcare discussion? For the simple reason that it is a policy of the government now that to improve healthcare, we need more of device, more of medicine, affordable, accessible. Also, this must be made in India. And healthcare is one of the major areas where this is a focus area, along with a few others. Healthcare is a focus area for Make in India initiative of the government of India. A lot has been said about healthcare, so I won't repeat anything about this. But the only point I would like to mention that today we lead a very stressful life. We cannot get out of that. But from stressful to stress-free, it's only possible through proper holistic hygiene and healthcare. Without that, a nation cannot go ahead. So we have, a lot of us have, in this country, there's the expansion, big expansion on healthcare, but health insurance. But more than that, we need really health assurance. And healthcare and preventive medicine only can give us the assurance. If you look at some basic statistics in India, manufacturing to GDP ratio is about 16-17%. And it is targeted by 2022 that it will go up to 25%, the percentage of manufacturing. The part of medical devices, which is manufactured in India, only 0.2-0.3%. Now, I don't see that as an obstacle. I think that's a big opportunity. Because there is so much to do where the field is far from saturated. In fact, it's waiting for all investors to invest and make in India program successful. And this, the market for wellness market, as it is called, is going to approach very soon a figure of 1 trillion Indian rupees, which is a hell of a lot of money. The medical device today is around $5 billion and is targeted in India to be about 30, which is a huge number. Today, it is also important for another reason that diagnostics have become an essential part. We mourn, actually, the older age people, they mourn that earlier days, somebody came and take your pulse, sat with your pulse for 15 minutes and then diagnosed everything. Today, no way that you can go like that. And diagnostic means what? Diagnostic means more device, more electronics, more hardware, more software. Unfortunately, this is today very, very import-driven in this country. So what is needed actually to see is how we can turn the table and make it later on, first the need of this market in the country, but later on how to export it. And that's going to be a big challenge. We have heard about telemedicine being talked. Telemedicine, a lot of hardware has to be manufactured for telemedicine and also software. So all these things show the importance of Make in India as far as healthcare is concerned. And the technology, when it comes with things which have to be manufactured. And that is, it will increase access, it will reduce burden, reduce load, It will make delivery much easier, clinical outcome much better, and with quality. So that's why the equipment is so necessary. Just to give you one example, GE, which is one of the largest conglomerate, engineering conglomerate in the world, I don't know whether you are aware of this, they have set up a base in India, and they have already started exporting to all over the world. They are based, actually the company is from US. They have started exporting to all emerging markets at a very low cost medical devices, which we were importing earlier. Now with the same thing are made here and with a much lower cost, and their target, they think that they can make such things average 40% cheaper, and they have 10 to 15% of the global market in another 4 or 5 years' time. So if they can do it coming from US, there is no reason why we can't do it even much better. Biotech is another field, pharma is another field, where I think the people, our panelists will talk on this. There is a great need. There is a great need for all this, but scarce resources. We have scarce resources. Solution has to be affordable, resilient, reliable, easy to spread around, fast growth, vital, touching lives of all people. And that's the most important thing. The future seems to be also very bright of such equipment, healthcare equipment. I mean, if you read today what are the novel techniques which are coming in healthcare, it will look like fiction almost. Radio surgery, optical scanner, no intervention, no invasive technology, but you can measure your sugar, make many surgeries without any problem, without being invasion, without making it invasive. If you have a very bad headache, migraine, you don't have to take a tablet. You have to only stop by a procedure here, you can stop the nerve from taking it to the brain. And like that, it sounds like almost, as I said, fiction. And all these will need a lot of things. And that has to be made in this country. And that's why healthcare is so important for Make in India movement. Okay, I think I'll stop there. I'll request that, you see, we are so late, and then we have four speakers now. So I would request each speaker just to say their mention about their experience in this field, connected to Make in India. They are all very expert people, experienced people with expertise. And they have a lot to say, I'm sure. But unfortunately, time is always a problem. So if you can finish it within 5-7 minutes, I shall be very obliged. You be your watchman. You look at your watch yourself. But please, because I want there should be an exchange between the audience and the dais. So if we can finish it quickly, then we can, of course, try and have some time for question and answer. So first, I will ask Mrs. Richa Dasgupta here from Fortis, and to give us her experience. Fortis is a big group, and they are running a big hospital. What is their experience as far as the medical devices, as far as the pharmacies go, and connected with Make in India, how much they're dependent, what difficulties they are dependent, what difficulties they are facing in it.
Thank you very much, Mr. Mukherjee. I think you've set the ball rolling and done very well. Thanks so much. Now, with the risk of sounding repetitive, I'm going to ask a question to the audience. Since morning we have been hearing about, so what are the biggest challenge that you see as a person which is related to healthcare? Any of you? Accessibility. Yeah, that's one. Manpower, trained manpower. Right. Right. Affordability, cost, yes.
I think not only affordability, there should be adequate logistics so that it can reach the government. There are much money is there in the government, but government is not using it properly.
Delivery system.
Logistics. Delivery should be there properly. So
Sure.
that you can go deep into the brain. That is my experience.
Sure. So my view is nothing different from what you think. Now, when we talk about Make in India, I would have been surprised if our Honorable Prime Minister would have not included healthcare. But he did. When he spoke about these 25 things, which he wants to be included in Make in India initiative, So healthcare is very much part of that, while it is categorized under pharmaceutical, and the other broad heading is wellness. Now, I'll tell you, when we talk about affordability, a lot of time, private player, and especially groups like Apollo, Fortis, Max, they get penalized, they get accused, literally, I can say that they're very expensive, they're making money, it's so expensive, can people afford it? It's a social cause, people should be healthy, it should be our right to be healthy, and we should have kind of access to any kind of health care, whether it is private or public. So see, on humanitarian ground, we are not averse to the idea that yes, it should be affordable. But other part of it, if you look at it, what's the cost structure today that we face? When we look at running a hospital, eventually, in earlier session, Dr. Ravi said that yes, it does have to have business sense. Otherwise, how do we run the hospital? So if we go to the cost structure, what does it kind of encompass? Largely the consumables. Even before consumable, that is related to operations. If we talk about setting up a hospital, medical technology constitutes a big part. Dr. Rana has been involved in project for long time. He would agree with me that around 40–50% of your cost actually gets into medical technology. And when I'm talking number, let me talk more numbers. So if we look at our medical devices, the complete market, the complete expenditure is 35,000 crore. It's huge. And let me also tell you at the same time that 90% is imported. And that's where the cost is hidden. Now, if we talk about Make in India, if we start to manufacture these medical equipment, because in terms of technology, I have no doubt that we have got big scientists sitting in here. DRDO is playing a huge role in terms of getting a lot of research happening around medical technology as well. So if we start to manufacture this in India, the cost is significantly going to go down to the tune of 40–50%. And that can easily be passed on to patients. Because if you ask me how do I do costing, it's very simple. One is that how much I have invested in, where I want return. And second thing is what the market is pricing it at. So there are two factors to it. If my putting in expenses or to kind of project cost is much lower, obviously the cost to the patient is going to be much lower as well. So that is something when we start the hospital. Now, second thing, if we talk about the cost part of it, now look at the diagnostics. So those who run hospitals, they would understand that the revenue, around 40% comes from your diagnostics. And if you talk about lab, whichever you talk about, and largely it's around laboratory, again, your 30% cost goes into consumable. And further on, when you're importing it, there is a tax to the tune of 25–30%. So where do we stand in that? So if we have the consumable cost coming down, because again, it's Make in India, the tax structures are going to go down, the cost will automatically come down. So from healthcare providers' perspective, what I wanted to highlight is the moment it's Make in India, the cost for all of us is going to go down, and the healthcare is going to be much more affordable to the people of India. Yes, am I optimistic about it? Pretty optimistic, because I think in last 1 year's time, a lot of improvement has happened in terms of a lot of steps have been taken in. Mr. Mukherjee spoke about setting up shop here to ensure that, more and more. Even when I interact with people, so I had a meeting with the Philips people a few days back. So what they're saying now is that high-end technology, high-end equipment, not necessarily that all the diagnosis requires that kind of high-end technology, and even consumables, you can have different category of consumables being available, right? And research part of it, if you start research, the molecules are generated here in pharma background, then again the cost is going to come down. So that's my thought around Make in India. And I think it's a very good initiative. And if we are able to implement it well, it is going to benefit all of us, whether it is provider or the seeker, that's the patient. Thank you very much.
Thank you very much, Richa. Not only just finishing it on time, but you have hit the nail on the head that medical technology is today going to be and in future going to be even more larger percentage of the total project cost, which I have seen personally actually when the last hospital that I was attached to happened. It is a large part of this cost. So therefore, it certainly is a major expense, and the expenses are supposed to come down when it's made in India. Thank you very much. I would now request Dr. Srijan Mukherjee, who is an expert in maxillofacial surgery, to briefly give his points.
Thank you, Dr. Mukherjee. I will. Well,
You have been getting a macro picture all this time. I'm primarily a specialist surgeon, and I just happen to have to run a small setup, a micro setup, on a specific subject. And the issue that we are discussing about, let us enter directly because time is short as we have been discussing. I will keep the pharmaceutical side apart because it is a different ballgame, and I'm going to talk about the rest of it because pharmaceuticals will be covered just after me. As a surgeon, the things that we are bound to will be enough, are some heavy equipments, some investigational support devices, hand instruments, implants that will live inside the patient, and things can go as fine and small as even the stitches. Do we not have manufacturing of all these in India? We do. We actually have all these products made in India as well, but the quality, if you have to compare, because all of us who have been trained in a wide range of areas all over the world and got used to a certain quality to be used in human beings, we cannot use many of the products that are made here because it is actually the second and the third class technology which is being used in India has got much superior technology. But because the 1:1 revenue generation out of the medical products is difficult in certain areas, because really investing on high tech is like investing on the expedition to Mars. One day it can be the most valuable investment that you have done. But today, for a few days that you look at in the near future, you may not see the 1:1 return. That's why the players who are into the field of developing some of the equipments, the things that I have discussed about indigenously, their quality, unfortunately, really you cannot use it in the operating theater. So, we have talked about the problem a little bit. Let us talk about a possibility of a solution. We do have our biotechnology people, and unfortunately, biotechnology, the available seats to create a trained specialist biotechnologist in India, that is quite constricted. The number of biotechnologists that we will produce every year is quite limited. There has to be a focus on that side. There has to be a core group to visit the rest of the developed world and actually hijack back our boys and girls who are out there in the biotechnology section of the biggest players in the world and let them get conglomerated with the specialists who are actually going to use their products. These are the surgeons and doctors that we are talking about. They should sit together who have been used to using the best quality products, and these are people who have been used to producing the best quality product in the technology section. And in between comes the logistic issue which has been brought up just now. Who is going to fund all this? Now, this is an area where it is very easy to say that the government is not spending the funds in the right way, but government is not the only player in this. We must understand that. And we have to have government and private players, and there has to be, because it is a social issue, there has to be really policy decisions so that such developments of technology, which is at par with any other part of the globe, that develops here. It is not just somehow make in India, because that is possible and that is going on. There are big companies that produce, even I'm talking about sutures, stitches. They produce stitches. It is almost a small scale, but they are being produced in a huge way as well. But believe you me, when I put the needle through a tissue, I will not use names, but when I put the standard international brand, 10th stitch, 105th stitch doesn't really matter for the tip of that needle. But the Indian brand, by being very patriotic when I tried a few times, well, being miser as well at sometimes, when I tried a few times, after 10th, 11th, 12th stitch, I threw it away and I have never purchased it again. And these, I am not talking about tiny chantry producing stitches. I am talking about real huge companies which are producing these stuff. And another disastrous thing, because big companies are opening their shops here, their technology shops. Remember, a cutting drill, a tiny micro cutting drill that I would have used in England, or when I first came back to India and purchased directly from abroad, that lasted me 10 years. And when I am buying the same product, the same brand, but somehow partly assembled in India, it is not lasting me more than 18 months. It comes with a guarantee of 12 months, and it conks off very soon after the 12 months. And they always say that it is a tight fixed product, and you cannot open it up, so you have to throw the whole system, and you have to buy a new one, and that's how these products are being prepared when we are just following word for word the thing called Make in India. It's not exactly that. Bring the quality up to the level, and then only Make in India makes sense. And it is trying to get the quality rather than just another product being made here. That should have a bigger stress. That was point one. I will very fast finish off point two. The biggest equipment in our the biggest item, instrument in this industry is the specialist, is the person who is actually performing the show. And I believe quite a few postgraduate doctors are here who know very well that just at the end of the postgraduate training, I'm talking surgery because that's what I understand a little bit, it is very little that the person has completely trained into. So the post-graduation actual hands-on training area has not been addressed properly. Many of the associations, fortunately I'm presently chairing the Indian board in my subject, and we are working very hard to develop fellowship programs at different centers. We are getting centers together, and the funding for the maintenance of these boys is coming out of our pocket like chanda. That's how things are going on, and I don't think that is the best way for a huge country like India. This can develop. So there has to be a big stress on manpower, medical as well as paramedical, in the real specialty training to develop the best equipment here in India, because worldwide, because here our big focus is the balance sheet. Here, I think there is a big idea on the economic side of things, and as I think today only we had something in the newspaper which clearly stated it, what is the huge degree of influx of international patients from the developed countries to here, just from the cost point of view, and they also know that these are people who are equally trained and equally skilled, and there are infrastructures in certain pockets. So patients are flowing in, and that can be met really many fold, and that can logistically justify many of our efforts. But the first point has to be medics as well as paramedics being created in a fantastic work culture in a way which can only be developed by stars from the peer group who should be got together, because they are all scattered. Some of them are in the private sector, and when they're in the private sector, they're in one group and they are not friends with the other group. When they're in the government sector, they are sometimes very unhappy that for the same degree of work, they are earning less. These kind of human petty problems are there. Healthcare is an area where these problems cannot be given a priority. So a joint, as Dr. Bodua mentioned in the first lecture, in the lecture before this, the group discussion, was that the old-time trust hospitals and such stuff, there are certain interesting areas to be picked up from that. It has to be the similar mentality, but controlled in a very professional, modern-day, economically viable way. And that is possible by getting such individuals, such trained specialists together. So one is equipment, standard, quality, has to be given equal stress, if not more, than just to have an office to get things screwed together somewhere in India. That's point one. And point two, making the human resource the biggest instrument, the biggest equipment for healthcare in the right way, to the right precision and perfection. Because they are of that standard, they have proven everywhere in the world. And they do that here as well, but they are kind of like, these are just individuals. These are not groups and generations of people. Some of us are trying to train a few, but those are just absolutely inadequate for the problem that we are facing. So there has to be, like even Ms. Devagupta is here, and there are other big corporate hospital setups. They can all have a bank somewhere to produce better specialists. There has to be a basic level of incentive to survive and to feel happy. And this new generation of super skilled machines, finished products that we are going to get out of it, is actually what Make in India is going to help us, and that will also logistically solve a lot of problems. Thank you, Ed.
Thank you very much, Dr. Mukherjee. I think, you know, the phrase "Make in India" is not a complete statement. The complete statement is "Make in India world class." Unfortunately, that's left unsaid. But we have fought in this country for quality for decades, 80s, 90s. But I must also say, in the other field, outside healthcare, India has done wonders in matter of quality in different other areas. We have to bring in exactly the same spirit in the healthcare area. So this is one, and second thing, of course, make people, just as he mentioned. The first is equipment, then make also people. And that's another movement also going on for the last few years only. We have started very late actually, let's make it skill, whether it's a medic, paramedic, non-medic, whatever, make them skilled in whatever job they are doing. So these two are definitely going to help healthcare industry along with Make in India. Thank you very much. Our next speaker will be Mr. Subhash Mandal, who is Vice President and Chairman of Indian Pharmaceutical Association. So I would request him to give a very brief as possible, but must touch the pharma sector. That is most important. One of the most important thing in Make in India movement.
Good day, everybody. Without any introduction, I will go directly to the subject because our chairman has told that I have to finish within 7 minutes. I'll try to do the justice to the time. I'll start from a question from everybody, that what do we mean about the healthcare cost? Is it cost of staying, cost of, doctor's consultation, cost of clinical testing, cost of medicine? Is it all, or anything else is there? Well, these are all direct costs. There are some other indirect costs, like transport, travel cost of the patient as well the attending personnel. There are some, these two are tangible cost, and the third one is intangible cost. So the cost is cost of pain you are feeling. That could also be quantified and integrated into the healthcare cost. Anyway, I am not getting into the picture because I have been given a specific topic, that is Make in India, relevance in the perspective of from the East. Well, I'll start with the component of the healthcare cost, that is the cost of medicines. It is a very high, this cost is very high, and it comprise of a majority of the total cost. Now, the total healthcare cost of the world is now 2.8 trillion. Out of this, India shares a big chunk of this. Now, India's healthcare total revenue comes at $30 billion, which consists of 5% of the GDP. But one estimate says that it should be $100 billion by 2025, and its share should be 8 to 10% of the GDP. The expenditure that is projected to expand at a CAGR of 18% during 2008 to 2016, which will touch $53 billion. the medicine, as I have already mentioned, that medicine cost is a major component of the health care. Let us see what is the status of medicine manufacturing of our country. Presently, India is producing around 1,26,000 crores of medicine. Out of this, India is exporting around 65,000 crores of medicine to more than 200 countries of the world. So, this proves the quality of the medicines, because you know that 25% of the total export of Indian medicine is to US market. All of you agree with me, the US market is so stringent, it is really difficult to enter there. So there is no question of the quality of the medicine which is being manufactured by the Indian manufacturers. And another statistics will bolster the statement that India has the largest number of US FDA compliant plant outside of India, outside US. That is another. And India is also filing the maximum number of approval application every year next to US. So this proves that the India is producing quality medicines, and India is now considered as pharmacy of the world, because the India producing HIV medicines at very minimum cost and supplying to the market, the poorer market in the African countries where HIV is very predominant. This has happened because of several factors like the trained manpower available in our country. Our scientists are very smart to adopt the technology. And another very important aspect we have exploited, that is the Patent Act 1970, who allowed us for process patent. But it has been amended since 2005. Now we entered into the product patent regime. Nowadays, the situation is something different than the earlier. But still, the situation is very favorable for manufacturing the pharmaceuticals in our country. Now, I would like to concentrate into the situation in the eastern part of the India. Well, the eastern part of the India is consuming around 25% of the total consumption of our country. But very unfortunately, it produces only 1 to 2% of the pharmaceutical products required in this region. Therefore, there is a huge gap between need and supply. Here is a very important aspect to set up a new industry in this region. The other important thing is the population. This eastern part of the India is highly populated, so they need more medicine. Third important issue is this: the purchasing power, PPP, purchasing power of the people of this region is more. It is gradually rising in rural communities. So there is a huge market, imbalanced market. You can utilize this situation by setting up pharma industry as well as the medical devices. The gentleman talked before me mentioned about that medical devices, that his experience is this, that the Indian-made medical devices are not at par with the, the product developed in the other countries. But our Prime Minister has already identified this area, the medical devices area, as a thrust area, and he mentioned this in his speech, that government will concentrate on developing the industries who will produce the medical devices. And they have already taken up some steps. That is why the regulation on medical devices are being laid down, which will be coming within a very short time. Now the medical devices are under control. It was not under control. Now medical devices, around 2021 medical devices has been notified as drug. They will be monitored as part of drug. And yesterday you might be showing one, might be seen one news that Minister of Chemical and Fertilizers has declared that government is going to appoint one minister, separate minister for pharmaceutical and medical devices within 1 year. So government is very serious on this issue, and the investors can utilize this advantage. Another issue is, it was also included in the speech of our Honorable Prime Minister on this Made in India. He stressed on issue of herbal medicines and Ayurvedic medicines. The eastern part have the advantage because this part of the country has varied eco-diversity spanning from hilly Himalayan range to the marshy Sundarban areas, providing abundant number of medicinal plants. With this advantage, you could utilize for the manufacturing of Ayurvedic or herbal medicines. You can put up industry here. We have required number of manpower because in this region there are some quality institutions who are providing medical education, pharmaceutical education, and we have a number of universities who are producing a large number of science graduates. So with this advantage, I would like to conclude with this. The stage is set for joining the slogan, Make up India. With this, I would conclude my speech here. Thank you very much for your patient hearing. Thank you very much.
Thank you very much, Mr. Mandal. As you see that, as he showed actually, the numbers of pharma is huge. It's a huge number. And the beauty of it is that small, medium, very large, all types of industries are involved in making pharmaceuticals. And regulatory strictness is more coming on. It was already there for pharmaceutical products, but it's coming in more stringent manner. Therefore, again, the question of quality hopefully will not arise, or it will gradually be reduced. It can never go away totally, but it will reduce to almost nothing. Thank you very much, Mr. Mandal. Our last speaker of the session is Mr. Bhudev Chakraborty, who is from the Center for Development of Excellence.
Thank you, Mr. Mukherjee. So I am actually a little bit from outsider. First is from Hyderabad, not from the eastern region. And also I am actually a solution architect and a process person. Though I am involved in the healthcare domain for more than 2 decades. Now, I was associated with National Institute for Smart Government, and I was the region head for the Eastern region. And as a part of that, I had got the opportunity of working with the government of West Bengal, government of Assam, and Orissa, means Eastern region, a number of state governments in the healthcare area, healthcare domain. And when I was going through, because when we do this type of reform activities, the one thing we do is we try to find out what is the present scenario in the healthcare domain in all these places where we are doing the study. So we have done that study, and when we were doing that, we found out that there are 3 areas where actually the government, or I will say the people also, should focus. So these 3 areas are the first area, which I'm considering the first, and that is the process. Now, when we talk about process, everybody thinks that the process is just, the way we work and what is there to change or what is there to think of. We only talk about the technology, we talk about the outcome, we talk about how how we can achieve the things. But process actually takes a huge part, maybe 30 to 35% part of any healthcare institution. It is not only process of your doctors, means they follow the procedures for OT, procedures for even the investigations, procedure for diagnostics. Not only that, you also have the process of procurement. You also have the process of how you will utilize the resources. You also have the process of how you are going to treat the patients. Now, why I am saying this point, most of the hospitals, both public and private, they never consider patients as one of their partners or one of their clients. They consider the patients as a sick person. And there's a huge difference between if you consider a patient as a sick person and a client or a partner. Why I'm calling them as a partner? Because they are actually increasing your revenue. So they are your revenue partners. Think of your other revenue partners, whoever it is, when they come to hospital, how you behave with them, and when a patient comes to your hospital, how you behave with them. So this is, I think, the first change in process we must do, that patients are our partner, patients are our client, let us deal them in a proper manner. That is first thing. If you now talk about Make in India, because that is the topic, India has taught the world how to treat people, correct? Everybody in the world talks about that the Indians are the best people in the good relationship, how to discuss with, how to talk, how to treat. They are the most hospitable. So we are already there in this place. We have to only use it in our environment. If we can do that, automatically we have achieved at least 30% in our Make in India, just using our own traditional processes, which we are already expert. Second point, after the process, I want to go into the human resource. Already you have discussed, so I'll not talk much about it because number of people talked about it. Again, a world knows that the best human resource is available from India and China. So it is already known. Whereas when I visit the hospitals, both again public and private, I heard there's no doctor, there's no nurse. Yes, this is a common problem in any of the hospitals I have visited. Doctors are not available. I think some 450 or some even more than that, I think doctors vacancies are there in West Bengal. Nurses, it is very, very difficult to get. People are talking about how to create the more number of nurses. Paramedics, how many institutes are there to train paramedics? We started one in Hyderabad. I don't know, in Eastern region, any of them is there because I have never heard of it. It might be there, but I don't know. So the training of paramedics. Now, we have human resource. We have the maximum number of human resource available in India, and they are all talented as per the world standard. That is what the world says. They are talented, they are intelligent, intellectuals, but they are not available. So we have to make them available, that's all. So if we can make them available, we can use proper government and private setup to make them available. Again, another 30% of the problem is solved of Make in India. Okay, so we have got people, we have got processes. Now coming to the technology. If you talk about technology again, very interestingly, before coming to these domains, I was working in DRDO, Defense Research and Development Organization, in development of missile. I changed my top subject a lot. When we can develop missiles, and number of them are indigenous totally, and not even a single component in being used from outside, like Akash missile, if we can develop that, we cannot develop such small components, and we are talking about quality. You can understand the quality required for aeronautics and aerospace, the quality required. And quality required for defense, which follows the MIL standard, military standard. We cannot develop the quality for just a healthcare domain. Very much possible, extremely possible. Means it is just a, we have to take it step forward, and we have to do it. So I feel that technology we are behind not because that we cannot develop, because we don't want to develop. For example, just now I talked about that missile development. Why we could develop these indigenous missiles? Because US stopped giving components to us. Because we have been told the cryogenic engine will not be given, and we have to develop it, we developed. They told nobody can sell supercomputer to India, so we developed a supercomputer of Indian origin. Same thing, if all the healthcare companies start saying that we will not supply any healthcare equipment to India, you will see that within 2 to 3 years, India has started developing and manufacturing all healthcare equipments and components required in the hospitals. So we don't want it. So my suggestion is that, or my request I will say, is that at least some of us, if we can come forward and we can start taking some initiative that some of the components we will develop and we will try to make it, I think it is very much possible. So these are the 3 things: process, people, and technology. So for any system to work, these are the 3 major pillars we are supposed to touch. Now this is about India I talk. Now coming to the Eastern region. If we talk about Eastern region, the first problem I faced is totally my personal opinion. So I may hurt some of the sentiments there, but I just wanted to say that. That is, the initiatives of Eastern region has deteriorated. Initiatives, I'm saying. I'm not saying anything else. Their intelligence is there, their skills are there, everything is there. But the initiative has been deteriorated. They are going to South and doing wonders. They are going to West and doing wonders. They are going to US and doing wonders. But they are not doing wonders in Eastern region. So I think this is one of the things we have to start, that get back the people who are outsides, who have achieved something, get back to the Eastern region, to Kolkata. I know I've seen some people started coming back. I have seen some initiative in the Bengal Chambers of Commerce, in Government of West Bengal, to bring back some of the people from outside. But my suggestion is bring back, create a proper development environment in the region, proper development environment, which is congenial, which actually asks people to bring excellence out of it. So bring that environment, bring the people back. I am sure we have discussed today morning that West Bengal was manufacturing more medicines than Andhra, and now Andhra is manufacturing more, Telangana is manufacturing more medicines. It may change. It can change. So that is one thing I want to say, is that bring the environment back, bring the people back, create a proper initiatives within the Eastern region, and I'm sure Make in India in Eastern region is very much possible, and we may achieve much more than what the other states have achieved in India today. Thank you.
Thank you very much, Mr. Chakrabarty. Yes, you have pointed out rightly. There are 3 things: process, people, and technology. And all 3 are equally important. All 3 are equally important, but we come back again to the same thing, that people they are brilliant, intelligent, but we can't use them because they don't have the appropriate skills. And we are very good when we are starved. We are starved of technology, then you make it here. We are very good in frugal innovation, 10 rupees per kilometer for journey to the Mars, or something like that, whatever. So this is something that we do very well. And initiative, well, that's for discussion maybe in another session, whether initiative in West Bengal has gone down. But it's quite true that we have to do much more in that direction. Anyway, thank you very much for your observation. Before I close, I think there is a hint already on my left side, on my right side, to close the session. But maybe one or two questions, if anyone has them. Anyone has them? Any question? Well, if there is no question, then I will just mention one incident and close the session. When Professor Kalam, the late lamented president, when he was the president of India, he went to a meeting in Hyderabad. And after the meeting, apparently, some people came to him for signing autograph. So one 12-year-old girl, around 12-year-old girl, came to him and asked for his autograph. So while signing, he asked this girl, what do you want to be? What is your aim, ambition in life? And that 12-year-old girl said, I have only one ambition, to grow up in a country which is developed and not developing. And then Professor Kalam gave his comments that the two things which are drawing back India. India is great in many things, but two things which are drawing back India. One is primary education and one is primary healthcare. Unless we improve them, India has no chance of going to the first row, which is its ambition. It's not only the first row, but maybe the first or second position in the whole world. But to do that, the two most important things, priority, urgency, importance, is on two sectors, education and healthcare. I think that has been sufficiently reflected during the discussion, and we hope that with inputs from this conference, we'll be able to do something in that direction. Thank you very much for your patience. A hungry audience didn't behave like a hungry audience at all, and they were all attention and joining it wholehearted. Thanks to my panel speakers. They have done a wonderful job within a very short time. Thank you very much.
Thanks, Mr. Alok Mukherjee, and putting in front of us the question that base has to be rectified first if we have to move further. That is very strong. Elementary healthcare, elementary education has to be the place. Thanks a lot. So I request Mr. Alok Mukherjee to present mementos to our eminent speakers from the panel. To start off with Richa S. Debgupta, Zonal Director, Fortis Healthcare Limited, Kolkata. A big round of applause, please. Srijan Mukherjee, Director, Calcutta Institute of Maxillofacial Surgery. Subhas C. Mandal, Vice President, Chairman, Indian Pharmaceutical Association. Bhudev Chakraborty from Hyderabad. I'll request Richa ma'am to present the memento to Mr. Alok Mukherjee. Can we have a group photo of the speakers?